He said I had to lose the weight. My life, you know, it's just a life-threatening situation.
But they do the work, and so I am proud of anyone who does this and works at it and sticks to it and loses the weight and improves their health.
My health is really good. My name's Joyce Larson, and I live in a small rural community in southwest Iowa, Newmarket, Iowa. We live out in the country. I've been married to my husband for 34 years. I have 2 children and 2 lovely grandchildren, and I was extremely heavy. I weighed 280 pounds. My diabetes was out of control. I was on 4 shots of insulin a day. I had high blood pressure. I had high cholesterol. I had sleep apnea. I was the poster child for going to hell in a handbasket. My doctor told me my blood sugar got over 600, and that if I didn't control it, I wouldn't be around for this Christmas. He said I had to lose the weight. And January 20th of last year, I had my surgery. And since then, it's been slow, but I mean, I just do it in small steps, but I've lost almost over 130 pounds. A person. That's a person.
Bariatric surgery is the surgical treatment of obesity. So patients who are more than about 100 pounds overweight, who have significant health problems related to their weight, surgery may be an option to help them lose weight and improve their health. That it's not just about the weight, it's about the impact on diabetes, the impact on high blood pressure, the effect on the risk of heart disease. It lowers the risk of cancer. And as we are understanding more of this, and as these operations are being done more, it's available to more and more patients.
This is a size 4X shirt, and I loved it. I wore it all the time because it was so comfortable, but it was tight. And then it goes with the pants, which are, no wonder they charge $2 extra for plus size pants, because they use more material. These are a ladies' size 30. Here's what a lady's size 30 pants look like. And these were tight. I had to suck in my gut to even get them buttoned. And I'll show you the one I wore to work the other day. These are my pants that I wear now. These are size 6'8" in ladies. I like the elastic, they're comfortable because you can bend over. And then the top that goes with it is a lady's size small. And it's just really easy. And I have plenty of room, and it's baggy, and it comes clear down over my hips. I think the last time I wore these size clothes, I might have been like 10, because I've always been heavy. Maybe 8. It's just amazing. And it's fun to shop for clothes now, but I have a $2 limit.
As a preventative for some people, and for people who already have those health problems, we can send them into remission. Most diabetic patients see a dramatic decrease in the number of medicines they're taking, and the majority get off all medicines completely. So they go into complete remission and are diet controlled for their diabetes. With high blood pressure, 2/3 of the patients get off all of their medicines within a year to a year and a half. And the list goes on. And so it can dramatically decrease the costs of health care by eliminating medicines, eliminating need for frequent doctor visits, eliminating some of the testing that's necessary. It also just decreases the cost of living. The food and expenses go down. The number of sick days at work goes down. The number of lost work days or lost revenue because of needing to go to doctor's appointments goes down. And so people can increase their income by being at work and decrease their expenses by not having as expensive a health care.
Getting down on the floor playing with my grandsons, they love to play checkers or go fish or something like that. I could get down, but it's that getting back up that is the problem. I'd have to crawl over to the couch, put my hands on the couch, and then push up to get that weight off the floor. Now if I play with them, I didn't even realize I was doing it. I was playing checkers, and we were doing something on the floor the other night, and I just stood up and walked to the kitchen, and my husband came out and he says, "Do you realize that you walked all the way in here, you sat down, and you got up without using a crutch, a chair, or anything? You just stood up and walked." And I never could have done that before.
Most of the people who I see who think about surgery, when you ask them the top 3 reasons, somewhere on the list, usually number 1 is, I want to be here for my children, or I want to be here for my grandchildren. And surgery will get you closer to that goal than not having surgery, because it lengthens your life. There are lots of things I think that set us apart from other programs. Because we are an academic program at the Nebraska Medical Center, we have all of the specialists that you could need. We are a multidisciplinary program. We have several surgeons, several nurses, dietitians, exercise physiotherapists, physician's assistants, dedicated psychologists to the program. And so it's an entire team approach to help patients get ready for surgery, during the actual operation, and most importantly after surgery, the ongoing care and follow-up to ensure that they have all the tools they need to be successful in the long term. On a personal note, the thing that makes this makes us different than anyone else is I am the only bariatric surgeon in Omaha who has had weight loss surgery myself. So I truly understand the needs of the patients, the goals of the patients. I understand exactly how hard this struggle is, and that gives me a relationship with my patients that I'm not sure someone who has not been in this situation can truly appreciate. The American Society of Metabolic and Bariatric Surgery Center of Excellence designation means that at the Nebraska Medical Center and with its partner UNMC physicians, that the surgeons are well qualified, that they have patient volume and outcomes that are good, with low complication rates and good long-term weight loss.
Oh, the follow-up is all immense. They give you a little pamphlet we call our Bible. It tells you what you can do this week, try it if it doesn't work, and they've got a phone number, and they treat you like royalty here.
I've had husbands send me flowers to thank me for giving them their wives back. I've had parents hug me and thank me for saving their children's lives because they were concerned that their 18-year-old wasn't going to see 20. I love it because it really changes lives, and it improves lives. And it improves lives for not just the patient, but it impacts positively their entire family.
With my diabetes, I'd had a stroke or something. I know I would have. My health is really good.